Okay, so several other systems, or all body systems really, are affected by prematurity. The hepatic system, premature infants are more likely to be jaundiced because there are fewer binding sites for that bilirubin and feeding is delayed. So the management for that, because the preterm fetus is, or the preterm infant is more fragile in a lot of ways, they tend to be much more aggressive in treating that jaundice than in a full-term infant. The metabolic system, they're more likely to have hypoglycemia because remember, everything takes more oxygen and glucose than in a full-term baby. And they also have less reserve of those things. So they're more likely to have hypoglycemia. They're also more vulnerable to fluid and electrolyte imbalances because they have a higher extracellular water content. For energy conservation, we want to minimize disturbances when they're feeding. We want to minimize disturbances in general. We're not doing a lot of stimulation with preterm babies until they are closer to the time that they were supposed to be born. A neutral thermal environment so they don't have to use energy managing their temperature. Gavage feeding, if they're not getting enough or not able to get enough, or they're working too hard for oral feedings, then at least some of their feedings are going to be by tube. Promoting oxygenation, we want to make sure we're minimizing how much work they have how much glucose they have to use to breathe. So we want to support their oxygenation, and decreasing environmental stimulation. The immunologic system, their immune systems are immature and they have limited ability to fight infection. Infection also takes energy away from other vital processes. So the most important management is prevention. NICU nurses tend to be very aggressive about maintaining about infection control practices. They're very strict about hand washing and gowning and all of those things because those babies cannot afford an infection. So regular cleaning and change of equipment, hand washing, hand washing, hand washing. People who have infectious diseases should not be allowed to visit or work in the NICU. Fluid balance, preemies lose more fluid through their skin because their skin is thinner. They have a poor ability to concentrate urine, and newborns already don't concentrate urine well, preemies even less so, and so they're more likely to lose fluid that they cannot afford. And their intake can be challenged because their GI system is not ready for GI intake yet. Their kidneys and heart have less ability to handle fluids, so they're at risk for overload. So they're easily dehydrated and also easily overloaded. And the difference between that can be a very small amount of fluid. So management, they may be getting IV fluids if they're not able to meet their fluid need orally, but they're monitored really closely for fluid overload, fluid shifts. And if an IV infiltrates on that small, really tiny arm, they may end up with serious tissue damage. So they're monitored closely for infiltration. Remember that babies who are extremely low birth weight, who are tachypneic, they're breathing faster, or they're on phototherapy or in a radiant warmer are going to lose fluid more rapidly because they're going to lose fluid with that rapid breathing or because of the warmer. Integumentary, preemie skin is thin and fragile. Micro preemies are extremely fragile. You have to be very, very careful with tape, very careful with what you put on that skin. They'll absorb things in through the skin that you typically wouldn't. Management for that, no alkaline-based soaps. That's going to further damage the skin. Any skin products, anti-infective solutions and cleansers need to be used very cautiously because they're more easily absorbed. Anything that's put on skin needs to be rinsed well, and tape needs to be minimized, needs to be very careful, and we need to be very, very careful removing tape and adhesives. Emollients are controversial. They can actually protect skin from drying and damage and help hold in some of that heat, but they may increase the infection risk by trapping bacteria on the skin. Never use scissors at the point of where something is actually connected to a baby because skin and even digits can be very easily cut. So you never use scissors to remove a bandage or IV tape or anything. Zinc deficiency may cause skin lesions, so they may have to supplement zinc. Okay, in the next section, we're going to talk about developmental needs and family needs for preemies.